So feel free to do your thing. I'll just hang out. But
okay, I'm going to make you a presenter real quick before I forget.
Perfect.
And then, let's see. Tiffany Arnold is going to be your producer. So she'll be joining in a little while, and she'll help you. I told her I put your PowerPoint you sent me into the Google Drive, and I told her it's in there. So she'll have that as a backup if you all can't share it.
Perfect.
So you should be good. All right. Just holler if you need anything, okay?
All right. Thanks.
Hello, Maggie.
Hey,
Hi.
can you hear me?
I want to apologize. This is Mary Thomas. I want to apologize for, I swear I changed your name in the program.
No, well, I remember speaking to you about it, and
I know.
I'm sure that it was just one of those things, but yeah, totally fine.
We're alternating in and out of the office, and I'm going through VPN, and I'm using my phone for a hotspot. So I bet the server connection dropped when and didn't save it. So I apologize for that.
Yeah, I totally understand. The whole thing is just like full of little tiny things that, can go haywire in any second. I totally understand.
Thank you so much. I appreciate that. Good morning.
Yeah.
How are you
Good
this morning?
morning. I'm good. Are you making me a?
I sure will. Let's see.
Alrighty.
Oh, you're already a presenter.
Oh,
So let's see if Maggie is.
Yeah, I think I joined a
You
couple
are.
minutes early, and I
All
think Anne
right.
already made me one too. So, yeah.
All right, then Tiffany, you should be able to make anyone else that needs to be made a presenter.
yep, I can do that. Yep, no problem.
All right, thanks. Was nice to see you, Maggie.
Yeah,
I'm
absolutely.
gonna flip into another and see if there's anything going on into another meeting.
Great.
Bye.
Adios.
So you have 4 other people, correct?
Yes.
Okay.
Yeah.
I'm just trying to keep an eye on the names so when they come in I can make them. Okay. Here's 1 and 2. All right.
And I think so. I'm pretty sure, have received the slides, and I think our first plan of action will be for me to just click through them, sharing them, and then, if my computer goes haywire or something, you'll definitely have them as a backup. So
Yeah, the 4 I got it as a PDF. I didn't get it as a PowerPoint, so it'll
Yeah.
look different if I have to do it, but I do have them pulled up
Okay.
right now.
And that's how I shared it. And I suppose I'm just quirky like that and prefer PDF, but so yeah, and then the way that I'm gonna share it, I guess I'll just try and share it now. So I'm just sharing my screen, and just let me know if you can see it and everything seems to be looking right.
Yeah, I can see it. I don't know if you want to get rid of that that bar on the right. There you go. That's better.
Okay, perfect.
It's a little small, but you're going to be talking about it, right? So I don't.
Absolutely.
Okay.
Okay.
All right. We're getting people in
Hey,
here.
Tiffany, it's Ann. You doing
Hey.
okay?
Yeah, I'm good. Mary was just in here, and I think we're all set.
All set? Okay, just
Yep.
holler if you need anything.
Thank you. Okay, Jennifer is a panelist, so I'm gonna make her a presenter. Emily, presenter. And I am pinning you all, which means that you'll be the ones who are on, like, that we can see. So attendees won't like be on the screen that's in the recording. You know what I mean?
Okay.
And it's funny because I never knew anything about that, and I teach on Teams 5 classes a week, and I could have been doing that to myself the entire time. So now I know. All right, so looks like Leslie Marie and Bela are the 2 that we are waiting on, and then all of the presenters will be here. Oh wait, there's Leslie Marie. Okay, make a presenter.
Good morning, you guys.
Hi. Is my audio working? Can you guys hear me okay?
Yes, perfect.
Okay, great, cool.
Yeah, I was just talking, well, I'll wait a second for Leslie Marie to join. Good morning. Good morning.
Good morning.
Okay, there's 4 of you. Can you all see each other on the screen?
Mm-hmm.
Yes. Okay.
Yep. Yeah, I was just talking with Tiffany that I can just go through and like boop through the slides as we're all talking, if that works, so we don't have to change who's presenting. Yeah, and if you guys just want to, tell me when to go next.
Great. That'd be great. I wasn't sure. I'm on a different setup than I normally am, so I wasn't sure if I'd be able to do that without 2 screens. So yeah, that would be awesome.
Okay, perfect. Super duper.
And have you all been in other sessions?
I've not made it to others yet.
Good morning,
So
Tiffany
can
Arnold.
I tell you to go through the slides, like next slide or whatever? Is that okay?
Yeah, that's perfect.
Cool. Sounds good. I also have not made it to other sessions, which I'm sad at myself of, but Zoom I just can't do it anymore. I feel like we're so close to it being kind of over that like
You're now rebelling and refusing to do anything that
I don't have to.
I got my first vaccination shot on Friday, and I'm just like,
Congrats.
the day I get my second shot, I'm going to a restaurant, dang it, and somebody's serving me food that I did not cook. It's going to be amazing.
Yeah, absolutely.
Yeah.
So I'm
It
going to
does.
share the slide, like the slide that says that people are, that shows what session this is. So when people come in, they'll know they're in the right panel. And then when you right at 10:30, I will unshare that and you all can start. So Maggie, you're the convener, so you can just go for it. So let me.
Okay. Let's see. Hey, Bela.
Hi.
We were just talking a second ago. My plan is to just be the one navigating through the slides, just for the sake of ease. So anyway, whenever you are ready, you can just tell me when to click to your slide and when to click off. So.
Do we have a plan of what order we're going in for intros?
Yeah, so I've just organized the slides alphabetically. So Jennifer, I think, is first, just by last name. And I think you might be second to last.
Okay.
Yeah. So let me look right now. I think you might be right after me.
Okay. And my slide it could just be up during my whole intro.
Okay, yeah, that's
I couldn't get the desktop app to work, so I can't see anybody, unfortunately.
Oh, okay, gotcha. Yeah, sure. I'll just put it on right when you start talking. That's perfect. So dun, dun.
Michelle, did you do a 9 a.m. session this morning?
Yes, I did. It was really, really good. It was the Foundation for Appalachian Ohio, which has started an African American community fund.
Oh, nice.
And yeah, so I don't know if you know Ernest Bynum, if you've heard that name before.
I've heard the name. I don't know him.
Well, he's like a 10th generation from Muskingum County, and in January of this year, I think it's basically him and his father, January 2020, started the African American Community Fund, and then they affiliated with FAO to manage the money. And they've given out a half a dozen grants. It was really informative.
Were there a lot of attendees in there, or
about a half a dozen?
good.
Which is really great. I mean, considering the time change and everything, and Sunday morning, and which is like I keep on thinking of the positives about this whole experience, and one of them is that they're recorded, so people can go back and watch the recordings.
That's what I was telling Nick last night, is that it's like I'm always conflicted between two sessions happening at the same time, so now I can go back and watch. But the session I was in yesterday, I was producing yesterday morning at 9, only had me and one other attendee.
Mm-hmm.
But it was such a good session. It was about The World Made Straight, which is my favorite book, and I was like,
of course,
super jazzed about it. But it was a great conversation. I just felt bad that they were only presenting to like one person.
Well, I mean, I think the recordings, though, you just don't know. I think we're going to be able to keep track of how many views there are on the recording. So I mean, I think that the other real benefit that I've been touting to people, I mean, I produced 7 sessions, so you probably heard my whole spiel if you were in any of them, but if the session ends early, like you could sneak out and pop into another one and the whole room's not going to turn around and look at you and wonder why the hell you're so late coming to this session, like when you're in person.
I mean, there are some advantages to doing the conference this way. Not that I want to do it again,
Yeah.
but
you know, I think it's worth, we'll carry on a business meeting right now, but I think it's worth talking about hybrid conferences in the future. So, but that's a conversation for another day.
yeah.
So will y'all send out an email after the conference is over, linking us to where we can see all the recordings and all that?
Yeah, so I have no idea what we're doing next. We're just trying to get through.
Fair enough. No, I think it's so nice that it's recorded, because I think other people also share sessions like afterwards, and I'm always so disappointed that I missed one.
Yeah.
And just imagine some of the past sessions if they had been recorded. Like, wow, that would have been some real key knowledge to have in Appalachian studies.
Yeah, no kidding. No kidding.
I'm wondering if they're gonna try to put the recordings on the landing page. I mean, that to me would make the most sense, but
yeah, like I said, I think we're, especially Anne, just trying to get through.
Yeah.
to 3 o'clock today, and then let's all just take a breath.
Well, I think it has gone very well. I'm very impressed.
So do I. I'm happy with how things have been going.
Like we said yesterday, the award ceremony was the most pleasurable award ceremony I've sat through this entire time I've been in ASA. So
yeah, I mean, not to take anything away from awardees, and it would be nice, you know, to hear their gratitude, but it just was so well done. It really was. All right, I'm going to close my video so I'm not a featured person now in the.
I pinned all of the presenters, so hopefully we won't be on there.
All right.
I also think it'll be funny that since all of these recordings start so early, that everybody that goes on to watch the recorded sessions gets to hear all of our lovely conversations before the session starts. So that'll be amusing.
I actually think we may be trimming.
Yeah, I'm cutting the film. Don't worry about it.
Okay.
Yeah. I would like to especially look at the sessions I've been in to make sure that we cut out all the stupid crap that I said before and after.
I have an intern that's his job all next week is to cut film. So
yeah.
And your technology skills are probably at their peak performance right now, I'd say.
they are. I've learned things that I never thought I would need to know in my life. And then I was told last week they're going to revamp Teams in the next couple of weeks and change everything. So then I'll have to learn it all again.
If they could just wait till the end of the semester, that would be much better for me.
That's what they said, that they got a lot of pushback, so they may wait till the end of the semester because academics are like, are you out of your mind, to do that in March? So hopefully they will wait.
Well, I guess it's about that time. Let's see, making sure I'm not muted. Okay. All right. Well, good morning, everyone. I'm super excited to be here with this panel and presenting to our audience today. Our panel discussion is titled Health Systems in Appalachia. And so our team is a group of both architects and anthropologists studying in different areas and practicing in different ways. But we're kind of brought together because of our shared interest in how power structures shape the livelihoods of inhabitants of the built environment. So our expertise ranges from different types of spatial awareness and, also kind of thinking about different forms of public health, but, the way that those things are kind of working together and the differences between power and agency are really kind of what we're going to be talking about today. So I'll go ahead and kick it off. We're all going to introduce ourselves quickly and kind of say what our area of expertise and research is in. So I'm going to pass it off to Jennifer Ackerman. And I am going to also share my screen with our slides. So just give me 1 minute here. And Jennifer, there you go.
Okay, great. Good morning. Hi, I'm happy to be here with you all today. My name is Jennifer Ackerman, and I use she, her pronouns. I'm an associate professor at the University of Tennessee in Knoxville in the School of Architecture. And in my work as a faculty member, I explore systems of power and health through the architecture of the built environment. Some of my experience with these issues came through a design build project that I led with students of architecture from UT to design and build an education center for a nonprofit sustainable farm in Knoxville called the Beardsley Community Farm. That farm's mission is to increase access to healthy food and education about food systems to foster cultural and environmental sustainability. Located in a public park, the Malcolm Martin Park in Mechanicsville, immediately adjacent to the campus of Knoxville College, an HBCU that has been undergoing a lot of change and transition, downsizing in recent generations. The neighborhood is majority of people of color, and the median household income is $9,000. So the architecture of the farm's new building exemplifies unconventional and alternative forms of production by positioning students as designers and builders, inherently subverting systems of power that typically govern architectural development. Maggie, can you advance? Thank you. Architecture can be a vehicle for reworking systems of power and increasing everyday agency through tactics of participatory design and alternative modes of practice. Architecture can also strengthen food networks in economically challenged neighborhoods within Appalachian cities. This diagram maps the fluid relationships that allowed us to operate in partnership with the community, with the farmers, with the city of Knoxville, but also working laterally with an architect of record, subcontractors, and material donors, all assisting on a pro bono basis. And that the kind of amorphous structure of this, which is quite different than other architectural projects I've been a part of, allowed us to kind of be the agent on the site, able to make fast decisions and get things done. Can you advance one more? Thank you. The Beardsley Community Farm project challenges the status quo for how public buildings in low-income areas are produced, using specific tactics of educational design build to advance critical agendas of increasing a community's agency and health. And advance one more. Thanks. The identity of the people served is rich, situated in a historically Black neighborhood, a mid-sized American city in Southern Appalachia. The community's identity is blended, urban and agrarian, diverse in race and ethnicity, in a city that's defined by industry, higher education, and research. And advance once more. Thank you. The architecture of the new building embraces these frictions. Its form, space, and materiality explore agrarian utilitarianism, progressive urbanity, and sustainability. The question, what form should the modern urban farm take, is as present as, what role does the urban farm play? Each seeking to advance health, knowledge, and power.
Great. Awesome. And let's see, I think Leslie Marie is next.
Yeah, I'm Leslie Marie Buer. I use she, her, or they, them. I work for the Choice Health Network Harm Reduction in East Tennessee. So we're based in Knoxville, but we also work in 2 more rural counties in East Tennessee. And I've also done work in Eastern Kentucky. And so whereas Jennifer's sort of conceptualization of space is often building positive spaces, I'm sort of there when space has been taken away from others or has been controlled, usually by the carceral state, or when people are being kicked out of space. And so space becomes really problematic for us when people are asked to leave it. And the pictures up here are actually, the left one is of a huge sweep in downtown Knoxville. There has been a space under the bridge under I-40 since I was little, and according to my parents, since before I was born, where there has been a large encampment of folks who are unhoused. And I certainly don't want to glorify that encampment, but that encampment was also a space of community, of care, and oftentimes of violence. So it's a complicated space, but a place where people who are unhoused from the region, from all of East Tennessee, often made their way, and it's very close to services. But in October of 2018, they decided to completely remove that encampment, and it no longer exists as that. It only exists as a day space. So people cannot sleep there at night. In both the city of Knoxville and other private and public entities have really used hostile architecture, as seen on the slide on the right, where people are putting up fencing around any space that people could sleep under to protect themselves from weather. And we just did a recent open records request from City of Knoxville, and as of about a month ago, they were also putting up bars underneath most of the underpasses under I-40, and to prevent people from sleeping under the underpasses at a cost of nearly $100,000 in the previous few weeks. You can, next slide, please. Thanks. And so again, I don't want to glorify these spaces, but this was actually in the Knoxville News Sentinel, and she was a longtime resident there. And it does become, as you can see, people build rooms under this with blankets and so forth and build their own spaces. So it does become a place where people can take care of themselves and take care of each other in very hard circumstances, but nonetheless, it does provide that space. Next slide. And then this is what it was the day after they cleaned it out. And we had talked about doing this presentation for ASAs last year. So obviously the year since then has changed dramatically. And it's actually changed dramatically of how Knoxville is working with people who are unhoused. And so according to the CDC, people were recommended to stop sweeping encampments and stop moving encampments during the COVID pandemic, because it would increase transmission and risk and susceptibility to COVID for both people who are unhoused and the surrounding communities. And Knoxville did abide by that until October. And so on October 8th, they again began removing people from spaces. And since October 8th, they have completed 88 sweeps of encampments in Knoxville. And instead of actually providing people housing, they are just spreading them out to other encampments throughout the Knoxville metro area and into surrounding rural counties. And so there is very much a control of space that is negatively affecting health outcomes. And we have seen when people are removed from these spaces, an increase in overdose, both non-fatal and fatal overdose. And we have also seen increases in transmission of infectious diseases such as HIV. And so right after this sweep in October 2018 and early 2019, we saw an outbreak of HIV among this population because they were removed from safer spaces to use substances. And so again, sort of both in East Tennessee and when I was working in Eastern Kentucky, we just see that space is taken over, oftentimes by force through local police departments. People are removed from that space and are prevented from connecting to each other and being able to take care of themselves.
Great, thanks. So I'll go next. as I said, my name is Maggie House. I use she, her pronouns. And my background is in architecture. I have a Bachelor of Architecture from the University of Tennessee, and I'm currently working as a designer in a private firm in Atlanta. So I'm sharing now part of the work that I had done as part of my undergraduate thesis, where I was mapping kind of more formalized forms of physical displacement, very much related to the types of situations Leslie Marie was just speaking about. The instances that I began to map were having to do with the introduction of infrastructure as a partnership between both public and private entities, which worked to erase both areas experiencing high poverty rates and areas of color. So this is an example of, you see the Lambert St. Louis Airport outlined in white here, and this gray area represents the amount of neighborhood that was completely demolished, as shown in this photograph here. And if you kind of see this smaller, much more zoomed out version of what's going on, this is the footprint of St. Louis, and this kind of blob is situating the entire footprint of the airport there. And then these different lines are representing census reported data of a community that I believe was 80% African American and had about 30% poverty rate. So just kind of expressing the pretty explicit nature of planned erasure in the built environment and how public and private entities kind of come together and work in these manners. At the same time I was conducting this research, I was also researching with Leslie Marie, as it happens, to think about community ownership models of resident land. So the benefit that we really saw while we were researching these things was it gave residents a platform to organize themselves in their own interest in larger public space, as well as immediate agency over their place of residence in their neighborhoods. So as you can see in this slide, and as well as the next, I kind of went through a process of kind of visually cataloging some interviews that we did with residents in a specific mobile home community, which is right outside of the McGee-Tyson Airport in East Tennessee. So the types of things that are outlined in these drawings are simply things that the residents wish to happen in their neighborhood, such as better trash pickup locations, paved driveways and walkways, community meeting space, and more planting space to provide shade and such like that. But I think where these things, or where our research was really pointed, was making sure that things like this were not implemented before community organizing around ownership, because what we found is community members had very little agency over their physical space when it was under the control of a landlord or a third-party owner. When residents kind of spoke about making changes to their spaces, they were quite often inadvertently gentrifying their own neighborhood by raising the property value, which is unethical and illegal, but they are kind of in a space where they have very little power over those things when they are not in ownership of their own land. So this slide is just showing an architectural space, which is a concept of residents being able to organize themselves and meet together in this kind of scenario where they are in control of their own space and neighborhood and such like that. So that's it for me, and I believe that Bela is next.
Thank you, Maggie. Good morning, everyone. I'm Bela Ostrak. My pronouns are they, them. I'm an applied medical anthropologist and research scientist in Western North Carolina. You will notice a lot of overlap with my introduction and Leslie Marie's. Our work has a lot in common, and many of the things I'll say about Asheville are similar to what Leslie Marie said about Knoxville. I am employed at a medical education center, but most of what I'll talk about here today is related to my community-based research with several harm reduction organizations in Western North Carolina. And the main one for this slide is the Steady Collective, which distributes safe drug consumption supplies and overdose prevention supplies to people who use drugs, and also advocates for drug user rights and healthcare. So I'm going to just really to introduce my work and the topics that I'll talk about today as we get into the questions. I'm going to just go kind of around clockwise and introduce some of the scenes where space affects people who use drugs and their health and survival. In the upper left-hand corner is Mission Hospital in Asheville. It was recently taken over by the Hospital Corporation of America, which is a for-profit based in Nashville. This hospital in 2018 implemented an extremely punitive policy that is applied to anyone who is suspected of or shown to be using substances or has a history of substance use. I'll probably talk more about the specifics of that protocol, but what we have found in the past several years is that people who use drugs avoid seeking care, even in the event of overdose or severe life-threatening infections, because of that protocol. And so that hospital space has become a place that is no longer safe for people who use drugs. And then the next picture over clockwise, and then several in the lower left-hand corner are spaces where Steady Collective has been distributing supplies and where unsheltered people and people who use drugs have been able to come for food and just to get in out of the cold for several years. It's a coffee shop, Firestorm Books and Coffee, and then around the back of the same building has been a community meeting space and a place where people could get free meals. In 2018, the city of Asheville, which is represented by the photo of City Hall, issued a notice of zoning violations to all of those businesses because of the distribution of safe injecting supplies on site for 2 hours a week. And so that became a very extended, very public, local situation with people either advocating that they did not want to visibly see unsheltered people and people using drugs in the neighborhood, and then for folks that were supportive of efforts to reduce overdose and reduce the spread of infectious disease, advocating to maintain a space where supplies could be distributed. The pictures along the right-hand side are pictures of public housing complexes that are administered by the Housing Authority of Asheville. The top one is actually was slated for demolition. It has not been completely demolished, but all of the residents were moved out in 2019 with promises that they would be rehoused in newer, nicer buildings in the same spot. There's not yet any sign of that redevelopment. There are luxury housing developments that have been built nearby, however. A thing to mention about space in Asheville, it is the second fastest gentrifying city in the United States. And the reason I'll talk some about public housing is that while the population, the Black population of Asheville is only 7% of the population, Black residents in public housing are more than 80% of the population. It is also a very over-policed and over-surveilled space. Anytime that you're in public housing, there are police kind of making laps through the public housing complexes multiple times an hour. And if someone calls 911 in the event of an overdose in public housing, police will respond before and often to the exclusion of EMS. So a lot of the people that I do research with talk quite a bit about feeling very unsafe, trying to address overdose in public housing because of police presence. The other two housing complexes in the middle and in the lower right-hand corner are still active public housing complexes. And in 2019 and 2020, respectively, Study Collective began doing mobile distribution in those public housing complexes. What has been particularly important for our work in the past year or so is that mobile distribution meant that even during COVID, it was possible to still distribute naloxone and safe consumption supplies. And with that expansion into public housing, the overall distribution of Black participants for Study Collective increased by more than 80%, even as the total number of participants dropped. So we really felt that for our work, the sort of explicit piece of harm reduction work that is anti-racism, that the commitment to being in public housing where participants had asked us to come so that they could receive supplies close to home and not have to be walking around with supplies, which made them a target for law enforcement. That was something that was important and possible even during COVID. So I will probably be talking more about all of those aspects as we get into the questions, but I wanted to just share a kind of a visual introduction.
Awesome. Thanks so much. And then Emily, I think you're next.
Hi, good morning. My name is Emily Wilson. I use she, her pronouns, and I am a designer in Nashville, Tennessee currently. Previous to that, I worked with Habitat for Humanity in a 900-person town in rural Utah, where kind of kicked off my research as I saw how our current supportive housing is failing people and how it's relying on so many nonprofits to do the work that I think our community should be doing. And so when I moved to Nashville, I quickly became involved in the year 2018, working with a group of colleagues to undertake research into affordable housing, specifically affordable housing in Nashville, that we researched across the state. And so I won't make you read all of these numbers right now, especially because with the new census data coming out, a lot of these are about to become obsolete. But one of the major things that we were trying to get across is battling NIMBYism is extremely bad in Nashville, and trying to help people understand that this is your neighbors, this is your family, this could even be you that is qualifying for affordable housing, specifically in Nashville as it gentrifies so quickly and the median income is increasing. There's people being left behind. Next slide, please. So our research, we kind of took a zoomed out look. We're getting into the numbers, getting into the policy base, but also we're trying to figure out how we as architects can fit into this field and like what role we can play to better the affordable housing landscape, especially because we're not developers, we're not the ones with the money, but how can we have a hand in controlling what this looks like and advocating for people as we design. And so we researched across the country from master plans to DADUs to policy-based, and started coming up with a list of what we thought were good examples and what were bad examples, and started to try and quantify those things. And next slide, please. And where our research took us was that, we use the word housing a lot, and there is this idea that like, yes, we need to provide shelter, and that is the first step, but what does that shelter look like? And is it in some cases harming people? And how can we stop that? And so there's this list that we came up with that's this thesis, but what it's really getting at is the key to affordable housing is community infrastructure. It is those other pieces that are creating space and giving people equity and power that is holding it together. And so from the end of this research, which is about a year ago now, we've been involved with the Nashville Promise Zone, which is a HUD program that's in Nashville. It's across, there's different promise zones across the country in various cities. And we're advocating for affordable housing in a couple different ways. And one of the ways that that's kind of changed in this last year is instead of sitting down with developers like we were before, now we're mapping evictions and looking at where we can provide eviction and housing rights advocacy support in those areas, which of course is being targeted in lower income and communities of people of color, and it's been very rampant through the COVID year. And then there's also been a project in Nashville, the Envision process, which has been targeting all of the Section 8 housing. Our MDHA, Metro Development Housing Authority, is renovating all of those spaces and turning them into mixed income housing, and adding a bunch of market rate units as well as a one-to-one replacement of the affordable, which is great. And it's providing a much needed housing, but there's not any way to keep them accountable currently, and like all the public infrastructure that they're promising is just that, a promise. They've done all the right steps of like community outreach and creating the list, but there's no legalese, right? And so how can we advocate for these communities and so that people don't get pushed out? Because currently there's only a 40-year requirement that they remain affordable for the next 40 years. And a lot of these people do live in these housing units for their lifetime. These are their homes and these are their communities. And now, they're being faced with a time limit. So yeah, that's all I have. Thank you.
All right, awesome. So I'll stop sharing my screen. We can see each other's faces again, and we'll jump into questions. I believe one of the first questions that we wanted to talk about today, which I'm pretty sure was touched on basically through all of our introductions. So I just wanted to pose a question to each of the panelists, or whoever wants to talk to it, about how explicitly anti-racism might manifest in our different fields of work. Again, I know that it is something that came up through our different fields and introductions already, but I wonder if somebody just wants to jump in and talk about it a little bit more explicitly.
I can talk about it a little bit more. Sorry. Yeah, I think it's just been really clear, I think, in the last year, especially like how people of color are being affected, and like specifically the Black communities in Nashville are getting pushed further and further out. And it's just, especially with the evictions that are happening, and like now that it's just something really daunting about seeing those on a page, which I have recently seen for the first time. And like as those like mappings in the community have happened, especially in my neighborhood in East Nashville, it's just exposing a lot of those inequities and how housing is such a racial issue and housing agency is such a racial issue. Sorry, I'm getting a lot of static on my end.
I can try to mute myself.
So I think that, sorry, I got off track there. But what I'm trying to say is I think that some of this, like providing people with their rights and providing people with like what their options are is such a, I know it feels a little cliche to say education is the first step, but a lot of that information is withheld from those communities, and that's not easy to access. And it's especially when you don't have a computer or where you don't have internet access and you live in a neighborhood that your library hasn't been funded correctly. And it's just like all of those barriers are put in place to make it impossible for you to learn how to find out how to advocate for yourself. And so I think that's just what I've been seeing in this past year, especially.
I think in Knoxville also, if you look at the history of some of the first large encampments that came about, some of them actually came out when the some of the primary Black communities in Knoxville were intentionally destroyed to make room for interstate and a civic auditorium. And so I think there's a long history there. And then if you look constantly, or right now, who is advocating the most against these and who is organizing against these sweeps is Song of Knoxville, who is doing a great job. And also who is building new spaces is the Bottoms in Knoxville is a group primarily of Black people. So I think there's not only a history of racism there, but efforts to address housing is largely coming from anti-racist organizations and is certainly being led specifically by Black women.
I can add a little bit there. I mean, I think at the time of the design build project we were working on, understanding the history of Knoxville College, understanding the history of Black residents and over generations, and how that story has changed, throughout the history of Knoxville, really. We tried to do a lot of informal canvassing in terms of getting community feedback as to what the project might be. And so we would, students and I would spend a lot of time volunteering for the farm, but also just as a way to spend time in the park and to try to talk with people just very informally about, what do you think this space should be? How do you think we could make it more inclusive and such? Part of the project included a landscape component that basically creates a little outdoor amphitheater space that can be used informally for market space, for classroom, for just gatherings and such. And so I think trying to kind of recenter the project to be on the neighborhood and the community as much as it was about whatever the farm itself needed, I think was an important part of what we were trying to do. And then I would just, kind of tangentially in my current work, there's a lot of effort going on to decolonize architectural education, to help students, help faculty, help all of us kind of understand the sort of racist history of, white supremacist history of power that has produced most of architecture as we are trained to look for it. And so trying to kind of be far more inclusive and expansive and investigate a lot of those kind of factors inherent in the built environment.
Maggie, you're muted.
Thank you. I was just saying, I think one thing that also is a thread throughout all of these conversations is how power shapes our work and the communities that we work with. I think it's fairly clear that I think each of us, through our introduction and through things that we were just talking about, I think we're kind of all working kind of against like this wall of power, if that makes sense, that's made up of a bunch of different things, and kind of keeps the status quo the way it is. It's made up of racist policies and attitudes, as well as classist attitudes, and a general cultural understanding of what is normal and what should be correct and seen in the built environment. So I wonder if you guys just want to talk about again maybe what those different levels of power are that you see that you're working maybe against or with in different circumstances, and how we start to think about those things maybe a little bit more explicitly. I think these are things that shape our environment constantly and have always been here doing the kind of negative work that we're all kind of talking about, but I wonder how we kind of start to unpack those things. Yeah. Do you guys have thoughts about that? I guess I'm just thinking about how in my own research, different zoning policies and the kind of process of gentrification or physical erasure seems to almost be invisible. And I guess that's something that I was trying to work at visually to kind of bring those things to light and, kind of document how different sources of power work. So I don't know, do you, I think we all maybe agree on that, but just wonder about some more thoughts.
I can talk a little bit about, so I think home ownership, right? There's so much power that is given to the individual, even if it's a struggle, or, and I'm not saying you should become house poor, but there's an equity that is created and kind of like a control of your own life that comes with owning your own home and owning your own space. And so whenever I was working in rural Utah with Habitat, I was working a lot with trailer homes. And that was just like this really complicated power dynamic of people that owned their own home but did not own the land it sat on, and did not own a way to move their home if they were evicted, and thus would have to abandon said home even though they owned it. And I think that was one of the first, real moments that I saw that I was just like, the power there is so unfair. Just not to be like, it's unfair. And how can we address that? And I see it now across the affordable housing landscape here in Nashville too, where there is a sense of pride and a sense of ownership in these communities where people are like building their lives, but the power is kind of out of their hands. And that power goes from like eviction to when they can leave, to repairs and the kind of quality of life they're having and the quality of the home they're living in. And they have no agency over that. And sometimes it's, I don't want to say it's like the landlord, but it's also it's the funding mechanisms, right? And we had a affordable housing fund here in Nashville that was cut in half a couple years ago. And it's like, okay, well, now those repairs are being put off another decade at least. And just like, and what if some of those repairs are your air conditioning is molding, and now that's affecting your health as an individual living in that home. And so those are the kind of, I guess, power structures that I'm seeing every day, and like how that filters down into one person's well-being because this high level decision is being made.
Yeah. And I think, so I'm going to talk about Eastern Kentucky and then East Tennessee. So I talked to many women who are going through substance use disorder treatment in Eastern Kentucky. And it was so interesting to me, and I think it highlighted the power structure or the power that having your own home does give you. So when I looked at outcomes of people who had this most successful outcomes in terms of keeping custody of their children, of decreasing sort of chaotic substance use, of doing things that they really felt that were positive for their health and their family. Both of the people who had the most positive outcomes own their own homes. And that was passed down from family. And so one, lived in a mobile home on, I think, dozens of acres of land and had access to all these sort of forest resources that were so important. Another person did own their home. And then when I think about the people who had the absolute worst outcomes, who are now incarcerated, and one of them incarcerated for life, they were unhoused at the time, or they were living in their car. And so it really does affect your overall life and your health outcomes. And then in East Tennessee, we certainly see that as well. And I think for us working in harm reduction on the ground, when people come and see us and that they say that they've seen another sweep, or we're there when they're doing another sweep of encampment, it's very easy for us to just go into really hating police, which for harm reduction is sort of an easy thing to do for us, because they do make everyone's lives so much more difficult and for no reason. But those decisions are above them. So this is coming from the mayor's office. It is coming from business associations. It's coming from neighborhoods who are complaining about people being around. And it's also coming from the police department, certainly, because they create these supposed maps and statistics that are used to argue that encampments should be removed. But there's just so much there happening, and it's hard for people who are working against this in a volunteer capacity, or their other lives that we are living, to fight all of that. So it's just a lot. And of course, housing is just one thing. They're also coming after us in all these different ways too. So it is very difficult, but I think also want to reiterate that when we talk to people, and we talk to a lot of people every day who inject drugs, and when we ask them, what's the one thing you need? What's the one thing that would change your life? It is never substance use disorder treatment. Never, ever, ever. It is almost always housing. Housing is the number one thing they want. They just want stable housing. And we have seen it really change people's lives when they do have access to it.
Yeah, I can echo everything Leslie Marie is saying. And I think an important thing I heard this week, just this week, doing interviews with some harm reduction staff, wrapping up a grant evaluation that was specifically focused on the expansion into public housing, is we were talking some about these sweeps, and harm reduction staff were saying, you know, we all kind of freak out and panic when participants come in and say that there's been another sweep and they've lost all their belongings. And we were talking specifically about how those sweeps increase overdose risk and increase the likelihood that people are going to have a hard time using safely or practicing some of the harm reduction methods that they otherwise would. And the staff were saying, so we have these really dramatic reactions to sweeps, and for participants, it's normalized. And so I'm thinking too about how a lot of these power structures are either invisible or just taken for granted for people that use drugs and the people that we work with. And so whether it's, you know, a participant showing up and saying, yeah, all my stuff got stolen again, like everything I own was taken by police. I no longer have a tent. I no longer have a sleeping bag. I no longer have any of my safe consumption supplies. And so I've been without everything I've needed to stay alive for several days. And I know it's going to happen again. And so I don't even know what to say, but sort of like having the space to be upset about it is something that those of us it doesn't happen to all the time have. And in the same way, another power structure that is a huge issue in Asheville is the healthcare systems and the healthcare administrators that can institute something like the policy admission, which is referred to as the IV drug abuse protocol, which at this point, what that looks like is if you either have a positive toxicology screen or urine drug screen upon admission to the hospital, or if there's anything in your chart that suggests that you have ever used substances, you're put in a locked unit. You cannot have your own clothes. You cannot have visitors. You cannot get phone calls or make phone calls out. You cannot see your children. You have a strip search when you are admitted. You cannot have any outside food. You cannot have a straw. So even if you've had something like neck surgery and you're in a neck brace, you can't have a drinking straw. And so these are incredibly punitive measures. And so that's part of why people won't go to the hospital. And this was another thing that the harm reduction staff were telling me in an interview this week is, I said, you know, how much do people talk to you about this protocol specifically? Are they just saying, oh, I don't go to the hospital and you know that's why? Or do they talk about it by name? And people said, they don't talk about it anymore. They talked about it when it first happened. They don't talk about it anymore because they just know that that's how it is. And so I think there are the power structures, and then there's also the getting used to the power structures so that they are just normal, that I think in some ways is even more insidious.
And I think it's also important to note that when a change like this happens, like at Mission Hospital, it spreads through the region very quickly. And so it is now at University of Tennessee Hospital, and it is at other rural hospitals in the region. And so as soon as one place in Appalachia makes this change, it spreads like wildfire. And I can give more examples, but I think it just happens so quickly. And so it's important to note that once it happens one place, it affects the entire region.
Absolutely.
I just wonder, do you all see the questions in the chat, or how would you like to?
Yeah, I'm sorry. I think we got carried away, but
Oh, no, that's fine. I just wanted to make sure you had access to that. And
yeah, are you guys seeing the chat questions? We would love to answer a few of these if we have time. I know we're coming up on 11:15. Tiffany, do you think we have a bit of time to answer some questions?
oh yeah, this panel goes till 11:45.
Oh, I was thinking, got lots of time. Okay, great. So yeah, the first question here, I think maybe can be aimed at Bela, and you might have already been talking about some of these things, but just talking about harm reduction in Asheville specifically, and maybe thinking about how rapid gentrification is affecting this.
Sure, and I'm not sure exactly how what the chronology of the question was, if it was is harm reduction a response to rapid gentrification, but I can certainly talk about gentrification and harm reduction, as can Leslie Marie, and I also want to leave space for other folks to address other questions. I mean, Asheville is gentrifying very rapidly, as I'm sure is not a surprise to anyone, and certainly the thought is that, especially in West Asheville, which is has been gentrifying possibly the longest and is continuing to gentrify very rapidly, there's a tension where people who've moved into the rapidly gentrifying parts of West Asheville and also are benefiting from rapid gentrification. So real estate developers, unfortunately some architects, are some of the folks that put a lot of pressure on the city to issue this notice of zoning violation. And so, we were very aware that there were neighbors right close to where distribution is happening at that coffee shop and bookstore who didn't want to see people that use drugs and didn't want to see unsheltered people around, because they thought that was going to threaten their efforts to encourage development and further profit from development. And so, we got some inside information at the time that the zoning violation notices were happening, that it had been specific developers and neighbors that were involved in real estate that had been calling the city, trying to get it shut down. So we know that there's a direct relationship between kind of city investment in and subsidies for gentrification and tourism, and what I would say is kind of backlash against harm reduction or lack of support for harm reduction. And we know that all of that together, the kind of municipal investment in gentrification, has really direct, measurable negative consequences for health outcomes for unsheltered people and people that use drugs. There's fantastic research that has been done that established something called the gentrification index, that actually can predict the likelihood that people who use drugs will be unsheltered, that unsheltered people will use drugs, and that unsheltered people who use drugs will have worse health outcomes, depending on the level of municipal investment in gentrification. So this is not new, and it's not mysterious. It's very predictable.
Done that like 7 times now. One thing that this line of conversation kind of makes me think of, on the architecture side of things, is this kind of maybe disturbing trend that I sometimes notice as an architect, that like gentrification isn't a bad word, it's just a thing, and like maybe even a good thing that could happen to a community, like, oh, like, I don't know, I'm not sure that I have a specific instance to point to, but I know that maybe in the architectural community, there's not enough understanding of the types of the power behind gentrification and the way that affects a community. It's maybe thought more of, unfortunately, as, like getting a coffee shop in a community, or like painting murals or something like that. And I wonder if Emily or Jennifer, maybe you guys want to talk about like education in the architectural community, and how we might be able to, or how like we're working in spaces like that.
I can share a little bit of that. I mean, I think I'm also teaching currently a professional practice course this semester, and trying to kind of radically reframe it to being one about ethics and various ways in which architectural decisions are affected by or really ultimately ethical decisions. And so if you take the kind of fundamental premise that architects are licensed to protect the health, safety, and welfare of the public, that we shouldn't only be thinking about that relative to like having adequate egress in case of a fire, but instead we can kind of really expand that to social concerns as to, health, whether that is a lot of the kind of very nuanced health questions that I think Emily has been raising, everyone has been raising, in terms of that having stable housing dramatically improves health outcomes in general. We could think about it relative to COVID and our experience in adapting to a pandemic year. Safety, I think I'm trying to argue, is fundamentally connected to social justice and kind of recognizing the ways in which the built environment has been racist and has been highly biased in terms of who profits and who doesn't. And welfare, I think we also can extend to sustainability and thinking about the kind of architectural imperative to make choices that don't contribute to climate change, or to recognize that architecture has potentially negative impacts on all of these realms. At the same time, I think we're looking at some of the agency questions as to what can an architecture firm do. I mean, that on the one hand, they're wanting to function, wanting to be able to pay people, wanting to create an ethical life-work balance for architects, right? That, like, what is it like to be a person in the firm? And that some of that does depend on capital, right? You do have to have commissions, but trying to strive for what is the balance? Who are the people that you partner with? What are the ethical values of developers? If the developers are your client, how do you negotiate difficult conversations there, or use your agency as the architect to kind of open up, seek educational opportunities or conversations if your client does happen to be a developer who's making choices, perhaps without knowledge or without wanting to consider some of the effects there. So I think it's a super complex question, and one that I certainly don't have answers to, but just trying to I think that we have a generation of designers who are wanting to be more engaged in their own agency and how the choices they make as architects affect others at multiple scales.
Yeah, I can add a little bit. Practicing, it's been a real education, right? Because you come in bright-eyed and you're like, I'm going to do all the things right, and we're going to only work on projects that I morally believe in, and that's just not, as I'm working towards licensure and things, that's just not practical. I have to do a number of projects that I'm not, my heart's not in. But I've learned that, like, even if the building itself isn't something that I'm like incredibly excited about, I'm like, it doesn't think it's serving the community, it is affecting the community, right? Like, it's coming into a space and it is creating the landscape in which people are already living. And it's like, okay, with that information, how can I design this space, the exterior, the space around it, in a way that the community is going to be interacting with? And when you were talking, Jennifer, it made me think about the project I'm working on right now. Is this like huge office in downtown Nashville, and it's going by a bridge that formerly was a place of shelter for a large amount of unhoused people, and now that is gone. It's been, it is now fenced off for construction, and it will be replaced with landscaping and other things. But in the back of my mind, as I'm working on it, I'm like, okay, well, how do I create a space that feels safe enough that maybe one day those people can come back and still feel a sense of shelter? And and so when the developer's like, should we put a fence up in here? I get to be the one that's like, I don't know that we should do that. And, and not to be sneaky or manipulative, but it's like, I see that as like the type of agency that I can have. It's like, I'm not a developer. I'm not controlling what this building is going to be or what new tech company is going to come into it. But I can start to think about like ways to make this feel better for the community it's coming in, and advocating for parks that aren't fenced off, green space that is acceptable, proper lighting to make things feel safer on the back side of the building. It's like all of those things that we do have like small amounts of power and that we can inject into everyday projects, because these things are getting built. Like, me not working on it isn't going to stop it from coming. And so how can I shape it to the best of my ability? And it's like, I got better lighting under that bridge, and that is open to me.
Yeah. And I think I wanted to just add about sort of this goes from the former question to the next question about rural areas. And so in Knoxville with harm reduction, the biggest issue we face is with developers and with police. But actually in rural areas, tourism comes in, especially in East Tennessee. And so in some of the counties we're working in, it makes sense if you're going to have one harm reduction program in a county to put it in the county seat that is sort of more central to most people. And if people are having to come to the county seat anyway to get services, they can just come to you as well. So to sort of have some centralized services, because we can't do mobile outreach in Tennessee when it comes to harm reduction. It's sort of an impossibility here. So we have to sort of have specific locations, and people are not wanting us to come into the main town because they are afraid that tourists coming through might see people coming to get our services. And so that has become a large issue with people being afraid that we are going to run off their tourist, which interestingly enough, in one county, I think tourists and the people who are leading them on what they're doing would actually make up a large percentage of our clientele. But people don't want to talk about that. And I think that was also the case in some of the counties in Eastern Kentucky where there are some state parks. And so that becomes an issue. And then tourism also plays on the other side of it, where we have some counties who the vast majority of people who own the land in that county do not even live in Tennessee, and sometimes not even the US. And so you have these vast tracts of land that are being taken up for tourism that cannot be used for the people who actually live there. So I think with harm reduction, tourism comes into play in many different ways, especially in rural areas. And then maybe we can talk more about how our work applies in rural Appalachia.
I would say I know that I am probably the furthest from rural Appalachia currently in the big old city of Nashville. But I think some of the things that I maybe haven't touched on are like some of the housing models and ways to create home ownership can work across the board. And actually Maggie already touched on a couple of them in her intro, but like things like community co-ops and community land trusts are much more accessible ways for a group of people to create equity for themselves. And I think there's just not a lot of information on those. And even in Nashville, there's not a lot of information. The first one was formed just last year, and there's been like really slow momentum, and not a lot of people know about it or even understand that that's a model that can happen. And to me, it just seems like one of the ways that I think rural areas can engage in affordable housing in that way and create more opportunities, because a community land trust doesn't have to be all one geographical location. They can be spread throughout a city, they could be spread across a county, but it creates a system of support and it creates a system of advocacy and a community for each other. And I think that is something that I'd like to see more of going forward.
Leslie Marie, I might just pose this to you, because when we started working together, you were working with the Tennessee Department of Health, and we have a question here that just says simply, how have you engaged with local health departments? So I wonder if you just want to talk about your experience there.
Yeah, and I want to say one nice thing that we have in Tennessee is we actually, now power becomes an issue here, but our Tennessee Department of Health is very concerned with housing, both in is the housing that is available safe and is there enough available housing. And so they have funded positions throughout the state to work on some housing issues, which is really nice, but then they don't really have the funding or the power to actually do anything. They just have the funding and power to make research that says that we should fund housing. But at least that's happening, if nothing else. But and also what's really nice about our local health departments is they are incredibly supportive of harm reduction in Tennessee. But how our legislation works is that, unlike Kentucky, where all harm reduction programs go directly through the health department, which is a totally different thing, here they're not allowed to really do that at all. And then it's sort of a different, and I know Bela has a very different relationship. In North Carolina, there's very different relationships with local health departments. So I think that they can be a really huge resource when it comes to harm reduction, when it comes to housing, but there's limits in what they can do. And there's also a problem that when they start taking the term harm reduction and don't actually do harm reduction, and they're offering services that they're calling that aren't actually that, because they're still enforcing massive amounts of stigma against people who use drugs, against people who are unhoused. And so those are just some of the, but I think it's important to have a good relationship with the health department, whether you're doing stuff around housing or around harm reduction, just so at least you know where each other stand.
Bela, I guess I'm just super interested now that Leslie Marie has called you out, but what your experience has been.
Yeah, and North Carolina is an interesting example where the state has received a lot of CDC pass-through money to address overdose and has chosen to funnel most of that into local health departments, which has led to kind of an explosion of local health departments opening their own syringe service programs at the county level without necessarily having done needs assessments first or following any of the international or national or harm reduction coalition guidelines about first assessing what is already being offered locally or what local folks who use drugs say that they need and want. So in some ways in North Carolina, we are in a weird situation where there is a lot of funding of duplicative, unneeded syringe supply programs that are not offering what people who use drugs want or need and are not offering it in places that they are comfortable going. And very, very often when a health department starts a new program in a community where there is already an established, long-term, trusted, community-based, evidence-based syringe service program, what it actually does is divert funds away from the local harm reduction program, because otherwise there have been places where the county was funding a community-based program where people had been going for a long time and where people who use drugs had a lot of input and were able to say where was an appropriate distribution site that they felt was not at risk for law enforcement harassment, where they might not have supplies immediately confiscated, where they might not immediately be arrested for bringing back used syringes, where they had a lot of input about how they wanted to be treated. And that then when that same county starts its own service program, those funds stop going to the community-based program, and people don't necessarily feel comfortable going to get supplies in a building where there's also sheriffs and DSS. And so I think, it was done with very good intentions, but another frustration that I hear all the time from harm reduction workers that I do research with is that also as this started happening, all of these county health departments came to the local experienced harm reduction workers, not to say, should we do this or how should we do this? But once they had already started and set it up, to say, teach us what we should do, and then very often didn't listen. So there's been an incredible diversion of financial resources, but also time resources without it necessarily benefiting the people that it was supposed to. And I think I had been working here in Western North Carolina. There are 3 rural counties that had actually applied for funding in partnership between the health department and an evidence-based, community-based harm reduction organization. And we were very hopeful. I mean, those were grants that I helped write, and then I'm the evaluator on them. And it was supposed to be, it looked great. It looked very promising. There were going to be linkage to care positions based at the jail. There were going to be overdose prevention strategies. And in each case, what we're seeing, and I've been hearing this a bunch from harm reduction workers as well, is that when you have a model based at a health department that seems very promising and that you feel like it might actually be a good health department community collaboration, it very often depends on a particular person at the health department, that it's kind of the one person at the health department who really understands harm reduction. As Leslie Marie was saying, it's somebody who gets that harm reduction is more than just handing out supplies, but that gets that it's kind of this larger orientation to eliminating stigma, treating people like human beings, and that if that person is not supported to stay at the health department, that often when they leave, that grant is rewritten to cut out the harm reduction organization in the community, or suddenly the funds are spent on something else. And so that's been a phenomenon, especially in rural counties out here.
I think one question that this should really actually go to the architects is, I think it feels like, at least on our end, that so much reliance on affordable housing is put on either philanthropic organizations or on sort of federal government supplied. So how do we start holding people accountable? Are there cities or rural areas that have examples of, sanctions for people who are not providing affordable housing, who are knocking it down, who are gentrifying without anything? Like, what can be done more than what is happening now, at least in the South?
I can say a little bit. This is this is a big crux of my work, really. Is, like in California, which we did a lot of research on California affordable housing, there are so many things in place, right? There's so many incentives and there's tiers, and like developers can get, all kinds of things if they include affordable housing. And so affordable housing is being built every day there. If you are developing mixed use residential in California, you have to include affordable housing. And if you don't, you have to pay into a fund that then goes to build affordable housing. Tennessee tried something a couple years ago where the city of Nashville actually tried to have an incentive written in, and Nashville passed it and the state of Tennessee repealed it or appealed it. And so then they tried to rewrite it and be like, okay, there's no punishment. There's, as a friend of mine puts it, there's only carrot, no stick, right? Like, this is just an incentive. You only get rewarded. There's nothing bad that happens if you don't do it. And the state of Tennessee said it was unconstitutional still. And so that's making a decision for the whole state, even though the city voted on it. And it's set us back quite a bit, I think, as far as trying to find a way to work around that. And in the meantime, we're already 31,000 affordable units short. And so having to go back probably 5 years of trying to advocate for the right policy that somehow we can get passed through, it's like we're going to be 100,000 units short. So I don't want to sound hopeless, but it's just that's something that we've been, struggling with a lot here, and don't really know what to do now that it was passed and taken away. But there are examples across the country, across the world, of things that are built in to public policy, as it should be, right? I think kind of like what you're hitting on is we value philanthropy over policy way too much, in my opinion. I think there should be nonprofits, there should be philanthropic work, but it shouldn't be the key to survival. But.
Yeah, I would just reinforce that. I love that answer. I think we can look to California for a lot of really lovely examples. Like I think of Brooks and Scarpa's practice as being one where they have a real commitment to public housing, but doing it in such a way where nothing is bare bones. It's not just trying to do the kind of basic minimum, but trying to kind of really just elevate quality of life for everyone. And I would say as well, a lot of the kind of architectural things that are possible in California that stem from policy also mandate sustainable practices. And so a lot of the most innovative work and examples of how to do it, how to be net zero, how to be affordable, is coming because it was required by law. But that other states can start to look to those examples and say, like, okay, well, look what is possible, look what is able to be done. And so it just kind of, maybe that it will slowly become adopted in other sorts of places. But yeah, I think this whole kind of challenge of not wanting to purely rely on the philanthropic or pro bono efforts, that all of that is kind of endemic of a bigger problem. And so, I'm not sure what the answer is, right? I mean, it feels like some sort of challenge to developer tactics or finding alternative models of developers kind of operating in a way that is more holistically oriented.
Well, I see that we only have just a few minutes left here, and I guess one of the things that we as a panel wanted to make sure that we included, which we have throughout the course of our conversation, but like something that makes us super hopeful and like maybe grounded in, you know, a case study, you know, something that we've experienced that we can kind of point to say like this is these are the types of actionable steps that we as individuals and like a society can be taking in the right direction. And you know, maybe the answer is like just California, but anyway, I'm super interested to hear from you guys, especially maybe you guys in harm reduction. I know a lot of what you do is really strenuous work, and was really interested to hear your thoughts on that.
So I just completed our annual report, and considering that 2020 was the year from hell, and I think we can all talk about it at that, like there's so many hard things, and there's so many people we lost this year. It was a really hard year, but at the same time, we were able to get out 95,000 doses of naloxone to the community, and they use that to reverse, I think, about over 1,600 overdoses in our community alone. And that's just our community taking care of each other, which is really awesome to me. And that in Knoxville, we have had so many organizations working together to talk about housing, to talk about harm reduction. I mean, there's, you know, we're doing work, there's East Tennessee Harm Reduction, there's SONG, there's a medic group, there's First Aid Collective of Knoxville. It's like all these groups coming together to really work on this and to really try to hold the city accountable. And I'm on another call on Tuesday night with these other organizations to talk about this. And so I think I've seen a level of organizing this year that is really hopeful, and that we're getting services out, and that we're also expanding to 2 more rural counties that we're just getting out there. So that makes me hopeful that we're doing the work because politicians refuse to.
Leslie Marie said a lot of what I was going to say. I mean, really, it's the mutual care in the ways that participants take care of each other and do this uncompensated public health work, which is a expression I borrow from Leslie Marie and appreciate and think is really important to just consider that so much harm reduction work is unfunded and not publicly subsidized, and then so much of the work is being done for free by people who use drugs, saving each other's lives every day. And so that for me is the hopeful part, is just seeing how just with so little people are doing so much with and for each other. And with the organizations I work with, what is really exciting is seeing a lot of regional organizing among 3 of the harm reduction organizations in Western North Carolina, and a lot of kind of shared lessons being learned and mentorship. And, you know, in particular, 2 organizations working in 2 different rural counties, Haywood and Madison counties. Holler Harm Reduction is a fairly new organization in Madison County. They work a lot with folks from the North Carolina Harm Reduction Coalition that are primarily based in Haywood County. And so just knowing that they are checking back in with each other all the time and saying, we're finding this is working for mobile distribution, what's working for you, or what do you do when your county commissioners say this, or, you know, how are you getting support from churches? And, you know, just seeing the amount of community care, it is really, it's what keeps you going, I think.
Well, I know that we have just over a minute left, but I just want to thank all of the panelists first. It's been a really amazing conversation, which I think more conversations like this, which are pretty explicit in the nature of the kind of battles we're fighting against inequity, should be happening more often across fields. So I want to thank you all for your expertise and taking your time out of your Sunday to be here, and then also for the wonderful questions that we've gotten from the audience. It's really been wonderful. And I don't know if any other closing thoughts, but yeah, it's been really wonderful. So
Thank you, Maggie, for organizing this.
absolutely.
Yeah,
Thank you all so much. This was great.
I'm not totally sure how we log off, or if we're just
You can just hit the leave button and the meeting will end, and then the recording will be posted for others who want to watch it later. So thank you very much.
Awesome. Thanks.
Thank
Bye,
you.
guys.
Thanks, everyone.